For asthma exacerbation, we need to give medications to address those two big things of the angry airway, that inflammation and bronchospasm. Then we need to also monitor for worsening respiratory distress. So number one priority, we want to give something to bronchodilate quickly, something like that short-acting beta agonist like albuterol. Remember, A is at the beginning of the alphabet, so we give it first. Then we can give oxygen if their pulse oximetry is less than 90% or hypoxemic. Then we can also give systemic corticosteroids, and remember to address that inflammation, IV or PO, something like methylprednisolone. Then we need to monitor for worsening respiratory distress. We need to do a chest x-ray to check those lungs. We need to see if there's any kind of infection that could have triggered an asthma exacerbation. Then we also need to take ABGs. These will let us know if there's respiratory acidosis, which is a sign of respiratory failure, things like hypercapnia and hypoxemia. Notify that healthcare provider and prepare for intubation if you see any signs of impending respiratory failure, and that includes paradoxical respirations, which is when the chest moves the opposite of normal breathing, or if you see sudden silence. Remember, the NCLEX may try and trick you and say suddenly stopping wheezing can be a good thing. No, because suddenly stopping wheezing or having no breath sounds means there's no airflow, and that's that silent chest. That's a respiratory emergency, and you need to call that healthcare provider right away.